HbA1c levels. Introduction. Anemia is a worldwide public health issue that affects both developing and industrialized nations. It has significant effect on both human health and social and economic development. It can occur at all phases of life, but pregnant women and small children are particularly susceptible. In nearly all geographic regions and across the majority of categories, females had higher risk of anemia than males. HbA1c is a glycated type of hemoglobin that results from glycation of NH2 terminal valine residue of chain of globin. HbA1c value depends on three major factors: the HbA found in reticulocytes at the time of their discharge from the bone marrow, the rate of HB glycation as erythrocytes age, since HB glycation rate is a function of glucose concentration to which HB is exposed, and third is the average age of circulating erythrocytes. HbA1c is affected by existence of HB variations, structural hemoglobinopathies, thalassemia syndromes, and number of studies have demonstrated that HbA1c values are influenced by several other coexisting conditions in addition to diabetes, including iron deficiency anemia. Aims and objectives. First aim is to study the level of HbA1c in non-diabetics with iron deficiency anemia, to study the association of iron deficiency anemia and HbA1c levels in non-diabetics. And third is to study the effect of iron therapy on HbA1c levels in non-diabetics with iron deficiency anemia. Inclusion criteria include iron deficiency anemia patients, and second is age more than 18 years of any gender. Exclusion criteria: patients with diabetes, patients with chronic renal failure, patients with anemia other than the iron deficiency anemia, patients have active blood loss, pregnant and lactating females, and chronic alcoholism. Materials and method. This study was conducted on 90 patients with iron deficiency anemia visiting the OPD and IPD medicine department of GGS Faridkot, out of which 15 was the dropout, taking the final figure of 75 subjects. The study was carried out after approval from ethics committee. All the patients underwent investigations like HbA1c, serum ferritin, serum iron, total iron binding capacity, hemoglobin, peripheral smear examination, mean corpuscular hemoglobin, mean corpuscular volume, and mean corpuscular hemoglobin concentration, blood urea, and serum creatinine. The diagnosis of iron deficiency anemia was confirmed when the peripheral blood smear shows microcytic hypochromic anemia and serum iron less than 30 microgram per deciliter, and total iron binding capacity is more than 300 microgram per deciliter, and ferritin less than 15 microgram per deciliter. Iron supplementation in the form of oral ferrous sulfate, that is 325 mg in each tablet, is adequate dosage as per the severity of anemia, was given to the patient for 3 months. And above mentioned investigations were repeated after 3 months of iron therapy. HbA1c levels before and iron therapy was compared using statistical methods. Observation and results. According to age and sex, 37.3% patients were from age 61 to 70, followed by 30% in the age of 51 to 60. And out of 75 patients, 68% were female and 32 were male. Distribution of patients according to presence of comorbidities. Out of 75 patients, 24 patients have comorbidities, whereas 51 doesn't have. According to severity of anemia, only 10 patients were in category of severe anemia, that is only 13%, and maximum were of moderate anemia, and 65%, and mild were 21%. Baseline data: at the baseline, minimum hemoglobin was 6.9 and maximum was 12.3, and mean of both were 9.56. And serum iron was minimum was 5 and maximum was 29.3 and mean was 20. And total iron binding capacity was 362 and maximum was 450 and mean was 390.12. Serum ferritin was minimum 3 and mean was 8.92. And HbA1c levels minimum were 4.8 and maximum 5.54 with mean of 5.54 and maximum value of 6.3. After 3 months, when we followed up the patients at the 3 months, HbA minimum was 8.5 and with maximum 13.8 and mean of 11.12. whereas serum iron was 20.6 minimum at 3 months and mean was 63.66. And total iron binding capacity was 230 and mean was 347, and serum ferritin minimum was 12.9, maximum 174.8 and mean was 50.28, and HbA1c minimum was 4.7 and mean maximum was 5.7 and mean is 5.16. Distribution of patients according to HbA1c level at the baseline. As we see in this slide, as the severity of anemia increases, the mean of HbA1c level increases. Comparison of various group variables at baseline and at 3 months. HbA was significantly increased after 3 months, and HbA1c decreases from 5.44 to 5.16 with a p-value of less than 0.001. And serum iron and serum ferritin was also increases, and whereas total iron binding capacity was decreases. Conclusion: in this study, we observed significant correlation between iron deficiency and elevated HbA1c levels in non-diabetic population. HbA1c increases with severity of anemia and vice versa. It is not possible to fully explain the relationship between presence of iron deficiency anemia level and decreasing HbA1c. Most likely, decreased erythrocyte indices and decreased erythrocyte lifespan and aorta morphology play a role. Although iron deficiency anemia is the most common nutritional deficiency, and results and mechanisms are still unclear. When considering the prevalence of iron deficiency anemia in society, common use of HbA1c, how anemia affects HbA1c, have become an important issue. Thank you.
So my question is, this study is in non-diabetics, right? Does it have any application in diabetic patients? Because according to you, if you treat iron deficiency, the HbA1c level improves. That means the patient with the diabetes should have the same thing which is what is in non-diabetics.
No, sir, because diabetes also affect the HbA1c levels. There will be a difference in the results.
No, that's what I'm asking, you see. I mean, is it applicable for diabetic patients or not?
Not, sir.
It is not. The study is only for non-diabetics.
Yes.
So what is your carry-home message? What are you going to drive out of it?
We should approach differently for severity of anemia. We should use other method.
I don't think anybody with iron deficiency anemia will go for HbA1c levels.
Yes, sir.
What were the comorbidities observed in your study?
Sir, hypertension, there will be hypertension, cases of hyperthyroidism or hypothyroidism was also there.
None of your patients had HbA1c beyond the upper limit of the normal in your lab, though they were statistically different. Your lab had the parameter of what was the upper limit?
5.6, sir.
5.6. None of them had above 5.6.
Patient with
treated patient.
No, sir.
No, it was even less than that.
Less than 5.6.
So I don't think so.
Maximum was 5.6.
Hans.
So I don't know what is the implications of this study.
And what investigations were done to exclude patients of hemoglobinopathies and thalassemia?
Sir, HB electrophoresis was done.
Okay, thank you very much.
Thank you.